I'd like to invite now to join me Dr. Sue, as well as some of our patients that have been on this journey together with us. We'll have Mike Maxwell, Patty Arvin, Marta Gutierrez, and Joseph Reitmeyer.
Good morning.
Good morning.
Morning, Dr. Trong, all.
Hi. I'm going to let you guys each introduce yourselves, let us know where you're from, and then we'll get started.
Okay, I'll start. Sorry. Good morning. My name is Marta Gutierrez. I'm from Sacramento area.
I'm Patty Arvin. I'm from Vacaville, California.
I'm Joe. I'm from Riverside, California.
And I'm Mike Maxwell. I'm in Danville, Bay Area, California.
Wonderful. I want to start first with something that I think is a big decision for everyone who has a new diagnosis. Your treatment decision, how did you choose your treatment? And I'm going to ask, start with Mike. And Mike, you had an early melanoma. It was a stage 2, but we know that there's a higher risk of relapse for that type of stage 2, often similar to stage 3. Tell us how you came to decide to do treatment, and I'll share also that you decided to join the trial, the Checkmate 76K trial. Let us know.
Yes, thank you. This was actually my second melanoma diagnosis I had. My first one was on top of my head, where clearly I have very little protection. And my second was on my back, 2 spots on my back. And after surgery to remove those spots, the surgeon approached me the next day and said that there was a trial going on and it would possibly benefit myself, but it would definitely benefit others down the road. And for me, that was a no-brainer. My wife and I discussed it, and to think that maybe, and now as it turns out it does, and will help others, it was a no-brainer for us to jump in and do that.
Wonderful. Patty, you also went on a study. You were part of the DREAMseq trial, which looked at either targeting your BRAF with tablets that Dr. Mente and Dr. Sue discussed before, or doing immunotherapy first. And you probably heard that discussion, trying to decide which one we do first, and you did it on a study. How was that, going on a study where it was going to be either or?
I just knew whatever I did, whichever one I started with, I was going to fight this and I was going to do it. And I wanted to help other people to be able to find out more information about this. And it wasn't a hard decision. It was, this is what I need to do. And I need to do it for my family, for my friends, and for the world around me. And so that's why I did it. I started with targeted and then went to the immuno.
Marta, you're a very busy young woman. You're working, you have a lot going on. How was that to have a diagnosis where you're going to have to consider treatment? How was that?
Yes, it was traumatic. I was in shock for a little bit, a few days. But yes, I knew, just like Patty, that I needed to fight this. And I have 2 little ones, so I and my husband, and they were my strength, and I knew that there was no other way but to fight it.
And it's true. I mean, you did it after surgery, as Mike did, where there's a choice. But it's true. Do you want to do everything that you can, or do you want to watch and wait?
Exactly.
Joe, how was it for you? And I'll let Dr. Sue take you through that.
Okay.
Hi, Joe.
Hello.
I believe I've met you after the head and neck surgeon sent you
Yeah.
into my clinic, right? At that time,
Yes.
you had a parotid gland area swelling, and then you had a neck lymph node. So it's pretty obvious where the melanoma was. And you had a rib biopsy that in the bone involved one of your ribs that was
Yes.
positive for melanoma. So came on as a stage 4 metastatic disease. We decided to put you on immunotherapy as first line, even though you also are a candidate for BRAF MEK, like the target therapy. So you were on immunotherapy for about 1.5 years, and last dose was May 2018. And fortunately, you've been no evidence of disease or in complete remission since then. We've been following since then. You're off treatment since May 2018, right?
Yep. Almost 5 years.
Yeah. Yeah. So just a question for you, and maybe for the rest of the panel can join us as well. Talk about, you already discussed treatment choices. What are some of the side effects that you experience with your first line treatment?
I really had no side effects. I had the back pain due from a car accident in 2006. I was hit by a car, but overall, I've had no side effects.
That's great. Mike, Patty, or Martha, any side effects?
I had very minimal nausea, and I found that I had some skin rashing in my wrists and my ankles, and my dermatologist attributed that to the medication. The treatment was killing off precancerous cells, and that was where it was coming to surface. So I had a little bit of joint pain, but pretty minimal. Couple of days, and then I was good to go. Never debilitating.
Patty, you had both drugs on the study, right? You started on the tablets and then switched later to the immunotherapy. How was that for you? The experience, because you had a little bit of side effects with one or the other.
Yeah, the targeted
kind
therapy,
of a lot. With the other.
targeted therapy. Initially, I started with the higher dose, and I was very fatigued. I had some rashes, but it was really manageable. Taking the 2 pills a day, taking them about twice a day. I could do anything, go anywhere, and take my targeted therapy. But then I started having problems, and the cancer moved to my brain. And so I went off the targeted therapy and went to the immunotherapy. I always call it, I always use the first letter because I couldn't pronounce the drugs, but I used Yervoy and Opdivo on the second immunotherapy. And I had 2 treatments, I think it was 3.5 or 4 weeks apart. I had 2 treatments. And then I ended up having to stop treatment because I developed hypothyroidism and type 1 diabetes. And so I had to stop the immunotherapy then, but I had 2 treatments. And so both of them did wonderful things for me. It didn't come back in my lungs, and it hasn't come back in my brain. So that's been really good.
Yeah. And what's your life like now? I mean, it's been, I think, 2 years soon.
So I have been on Keytruda. I'm almost finished. 3 more treatments, and then I'm finished. But Keytruda has really helped me to continue living my life. I mean, I had a tough time, and 2020 was probably, I didn't think I was going to live through 2020. And I'm here in 2023, and I go everywhere and do everything I can slowly, one day at a time, tasks very small and everything one day at a time, but I don't stop. I just keep going. I do everything I want to do as much as I can do every single day.
Didn't you just take a trip?
I have 2 trips, 2 cruises.
Yay.
And I'm
that's more 2 cruises than me.
yeah, and I'm on my way to 2 more this year in 2023.
I want to ask one question because I think many patients wonder when they decide for a trial. You know, both you and Mike had a study and you didn't know which arm you were going to get into when you signed up. Was that a problem for you? I mean, for Mike, for you, it was either potentially nothing. You know, that was against placebo because that was standard for high-risk stage 2 at the time. How did you feel about that?
You know, again, it was more the opportunity to possibly help. And I guess if I hadn't gotten anything, I kind of feel like I must have gotten something because something was causing me to react the way it did. But I felt like, you know, just the opportunity to get in and possibly help others down the road, you know, a year later or however long it was going to take, that really was the attraction. And so it was easy. It was really easy.
Just to follow up on the idea of unknown future asked by Dr. Chuang. So Joe, how do you deal with this treatment stopping suddenly after 1.5 years? We didn't wean you off. We just say, okay, you have no disease. You know, how do you deal with that? And what do you think or do at home that helps you deal with the unknown in the future and follow-ups with oncology?
I just wait until I get an appointment with you or I get my scans. And when the scans say no, I'm all clear, I guess no cancer. But otherwise, I just live life one day at a time.
Great.
Marta, how about for you? I mean, you know, you had surgery, you're technically cancer-free, but you have a lot going on, like you said, you have a family. How is that for you after, like, what does the word cure mean for you?
It's very exciting. I don't show it, but internally I am so happy and so grateful. But yet I know that, you know, we have to take it one scan at a time. And I don't stress about it. I just don't stress about it. If it came back, I'll deal with it then. But today I'm just grateful to you because you helped me so much. And yes, just keep living and enjoying every single minute.
Sherry, so should we get to some of the questions? Because I know that I see a bunch of questions in the chat for us.
Yeah. So, okay. So we'll, everyone please add to the answer, especially based on your own personal experience. And that's very, very powerful for our patients to hear. Okay. So I would pick a few questions that's, I think, all of them are very relevant, but I'll pick a few due to the time constraints. So Kathleen Burrell asked our first question. The question says that she developed secondary adrenal insufficiency 4 months after finishing immunotherapy. Is that something you see in patients more and more, or just seeing patients? I believe there is Todd Jung also asked a similar question, had an autoimmune response in adrenal gland on hydrocortisone daily supplement for life, came about 2 months into therapy after Nivo and Ipi combination therapy, right? Neo-Ipi is same as Yervoy and Opdivo, right? So it is very uncommon to have, it's rare to have just adrenal insufficiency alone. And in that case, you may need to do more fancy testing like concentropin stimulation test with the endocrinologist, and they will help us oncologists to manage your disease, right? It's more common as a secondary adrenal insufficiency from hypophysitis, which is a pituitary problem that is a side effect of part of autoimmune side effect from the combination therapy. So the patient often gets steroid placement. Their lab values are followed by the endocrinologist as well the oncologist. If they're re-challenged by the oncologist, they put back on immunotherapy. They may need to check cortisol, TSH, free T4, these labs before each dose. We do recommend them to wear a medical bracelet in case of emergency, and that they may need stress dose steroids during illness, surgery, or infection or hospitalization. Okay. So again, it's not the end of the world. You're followed by the oncologist and the endocrinologist, and you do need to take supplements like Patty is taking, most likely managing her diabetes with help of endocrinologists with insulin replacements, right?
Yeah, so it can give you back what you lost. And if you needed more immunotherapy, this would not exclude you from doing that if you're otherwise well after that.
That's true. So let's see. There's also Debbie Roll. I developed rheumatoid arthritis. She developed rheumatoid arthritis, and it's believed caused by immunotherapy. Yes, you can have arthritis. Most of the time, it's not severe enough to, send to a rheumatologist. Of course, if it's severe, we do ask for rheumatologists to get involved and help us to manage with a stronger immunosuppression therapy. Just to keep in mind, we do not want to shut down your immune system completely because we want to still maintain the efficacy of immunotherapy. Right, so we want to control it and mitigate it so that you retain the efficacy of immunotherapy, which is mitigate the symptoms of the side effects, right? So if it's mild, we may just give you a very a small dose of steroids with a slow titration down to off, and we can do some intralesional joint injections with steroids as well. Okay, let's see.
I can take your question.
Okay.
Eric Niles asked about what are the current or prospective options for patients with NRAS mutant melanoma. So that's a great question, Eric, and thank you for the shout out. We love that you're doing well, and it's true. We have a lot of trials within Kaiser Permanente, but if we don't, we will find you an option outside if, standard treatment wasn't something that worked for you. And, in this community, we know, right? We want to be part of advancing the field. And so, I think especially patients, like Joe or others who've done it earlier, we know that sometimes we have to travel for some of these treatment options, because they weren't as available before. We love that someone like Mike can do it now closer to home, but we may need to do that. For NRAS, specifically, actually right now, there's nothing standardly approved yet, but just like Eric mentioned, there are several trials out there, one open at UCSF that are using oral tablets that target the mutation similar to the BRAF targeted oral tablets target the BRAF mutation in conjunction with MEK inhibition. And it is exciting that they work well for some patients also. So we are definitely very much looking forward to the results of these studies to see how effective they are. You guys may know that some people try to combine immunotherapy and targeted therapy. It can be sometimes a toxic endeavor, but that is something that we may look forward to in NRAS, similar as was tried with BRAF targeted treatments. And so, Eric, that's another thing to look for. Interestingly, for some patients, if you have an NRAS mutation, sometimes they respond almost a little bit better to immunotherapy. There was a multi-center retrospective study that thought that at at one point. It was never confirmed, but just as somebody with a BRAF mutation also should get immunotherapy and benefit from all those new treatment options, someone with an NRAS mutation would be similar. You want to take the next question?
Okay. And there's a question on for Vero. I like your name. How common is it for stage 4 melanoma patient to achieve a no evidence of disease with new immunotherapy options? And if there isn't evidence of disease after treatment, how common is there a recurrence of disease? So we're talking about durable remissions, I believe, durable response. It is more and more common because we now have in our repertoire like double agent combined immunotherapy, and we do have more and more data to support that. There's a lot of patients, like our patient panel, living right now with no detectable disease on scans or labs, on physical exams. And there's 4 or 5 year data to show that perhaps even half of the patient can remain alive and doing well, like in terms of survival, right? And some of them are still on these treatments. Some of them are off the treatment completely, like Joe, right? And most of these patients, I would say, achieve these type of response, like complete remission or no evidence disease, because they received immunotherapy as a first line, correct? And Dr. Chong, do you have anything to add?
No, I think, we have data from several trials, that patients with a complete response do very well. As a caveat on the trials, patients were on treatment for up to 2 years until progression on the initial studies that look back. In a retrospective single center study that was published by Memorial Sloan Kettering, anyone who had a complete response, they just stopped then without looking at how long the patient stayed on treatment, and there the relapse rates were higher. So, for example, this PET stop trial that I mentioned that was open through the NCI is trying to resolve that specific question. How good does your response need to be to stop? How much treatment do you have to get, even if you have a good response, to stop? So great question. We also have a question for our patient panel from the audience. It says, you talk about living in the moment. What do you do to switch your thoughts from intrusive, anxious thoughts about your diagnosis to focusing on the things in life that bring you joy? I'll have Patty start with that.
Initially, I didn't know how to do anything. When I went low, negative, I didn't know what to do. I just cried and screamed and wrote, journaled, and everything else. But now every time I get that feeling of like scanxiety and all those things, I tell myself, okay, you've got one life to live, and you can do it negatively or you can do it positively. I exercise, I do Tai Chi, I dance, I sing. Anything, when I get down, I do whatever I can do to bring me back from that negative thought. Oh, end life. Oh, this. Oh, that. Oh, another scan. Oh, I don't want to do this too. I'm going to do this. I'm going to breathe through it. I have this quilt back here that I leave on my chair. My friends made it for me. I'm going to inhale courage, and I'm going to exhale fear. And that's my mantra. And I have it up here on my wall, and I have all positive affirmations around my room. I just keep telling myself, you can do this. You can do this. And that's all you can do every day. One day at a time, 1 minute at a time.
I feel like I want to go out and do something now. someone else want to chime in too?
Yeah, I'll add to that. So yes, same thing. At first, it's very stressful, very scary, and then you just look at what matters. And in my case, I'm a runner, or I was a runner. I'm not sure if I'll be a runner again. So that brought a lot of pain because my melanoma was on the bottom of my foot, and now I have a scar that is very sensitive. So I don't think I'll be able to. I've tried, and I still have pain, which reminds me that I just have to take it slow and take care of myself. I've started yoga, which I absolutely love, and I walk. So I've just gone a different route. But that little step every time that I take and I feel my scar, it reminds me that I'm lucky to be here. So running is not going to be something that I'm going to be sad about, because now I am here and I could have easily not have been. So yes, that's where I go. I focus on my children, I focus on my faith, and I look elsewhere for that positive energy that I need.
Thank you. Yeah, I remember, Joe, you're wearing a different T-shirt with different slogan every time you come to our infusion center, huh?
Yes.
What was some of the positive messages was in your shirts?
I had a shirt that says, "I'm only here for the sexy nurses." I had a shirt that says, "I love my hot nurse." And I couldn't get the bad word shirt, but as a Christian, I wanted to just promote that, hey, I'm here for the nurses.
Yeah.
So I had a shirt for each nurse. I wish I could have found one for the doctor, but they didn't have one.
Yeah.
Just lots of prayer, and from all the churches I've been to, and they just just love me, and it's like got me through it. And family, friends. So family first. No, excuse me, God first, then family.
Then the nurses and doctors.
Then the nurses, yeah.
Nurses first.
Great. So I think it's time for. Do we have time for another question?
Mike, I think, wanted to say.
Okay.
I'll just dovetail on what Joe just said. It really is about prayer and giving it all up. We took it all in stride. It kind of happened fast for us. It came on fast, and then the surgeries were scheduled very quickly, and things happened really quickly. And so we went from, I was on the road traveling for business and golf and all kinds of stuff. And then all of a sudden, this gets in the way. It's just an obstacle, but turning it over, and you just have to realize it's not up to us. We are not in control. This really brought that home. And so my wife was a rock for me, still is a rock for me. And we just turned it all over to him. And that's what you have to do. You got to and then go one day at a time and take advantage of as many situations. And there's no sense in complaining, because, we have it. I think the four of us will agree. We have it pretty good, despite the punch in the mouth and the punch in the gut. But there are a lot of others that are struggling worse than we are. So take it one day at a time.
Thank you all. It's wonderful that you were able to join us. It's really amazing to hear your stories. And I feel always invigorated by hearing, your perspectives. And I hope, it's a thank you from me, from all of us, for sharing today. Thanks.
Thank you for having us.
Yeah, thank you. And sorry we couldn't answer all the questions, but there's a lot of resources and contacting Melanoma website, and please feel free to connect with us again.